So we have completed with the thorax in the last week, and now from today onwards we will be starting the lower limb. Right? What are the bones of lower limb? So the bones of lower limb are hip bone. Then next what comes? The femur, tibia, patella, then tarsal bones and metatarsal bones and phalanges. So in today's class, I'll be talking about the hip bone. So you can see here this hip bone. What is this one? This is the one side hip bone, and this is the sacrum, and this is the two hip bones and the sacrum form the pelvis. Right? And in this pelvis, you have what? False pelvis and true pelvis. False pelvis and true pelvis. So here you can see the hip bone, the two hip bones are joining. What is that called as in the center? What is this called as? Pubic symphysis. What is that called as? Pubic symphysis. And what type of joint is this pubic symphysis? It is a secondary cartilaginous joint. Secondary cartilaginous joint, and both the hip bones are joining with that of the sacrum. And what type of joint it is? It is a plain synovial joint. Plain synovial joint. Now the hip bone is divided into three parts. So you can see the hip bone has an upper expanded part and lower expanded part. And in between this, there is a constricted part. So the upper expanded part is called as ilium. The upper expanded part of the hip bone is called as ilium. And the lower expanded, the anterior-inferior part is called as the pubis. And the posterior-inferior part is called as ischium. So the hip bone, we have studied that there is a hip bone which is forming the part of lower limb, bone of the lower limb, and this hip bone is divided into three parts. So what are the three parts of the hip bone? The ilium, the upper part, the superior part is the ilium, and anterior-inferior is the pubis, and posterior-inferior is the ischium. Right, and this acetabulum is made up of superiorly it is made up of ilium, and superiorly it's how much is it? 2/5. The superior 2/5 or the upper 2/5 is formed by the ilium, and the posterior inferior 2/5 is formed by the ischium, and the anterior inferior 1/5 is formed by the pubis. Ilium, ischium, and pubis. And you see here, this acetabulum of hip bone is articulating with what? With the head of the femur. Is articulating with the head of the femur to form what? The ball and socket variety of synovial joint. That is the hip joint. So the articulating surfaces of the hip joint is what? The acetabulum of hip bone, along with the head of the femur. And it is what type of joint it is? It is a ball and socket variety of synovial joint. And you see here, and how is this acetabulum formed? The acetabulum is formed by the upper 2/5 is formed by the ilium, posterior and inferior 2/5 is formed by the ischium, and anterior 1/5 is formed by the pubis. And what are the three parts of these bones of the hip bone? The ilium, the anterior-inferior, anterior-inferior is the pubis, and posterior-inferior is the ischium. And you can see a foramen here. This foramen is called as obturator foramen. What is this called as? Obturator foramen. Right? Then if you see here, now we will study about ilium. So we already know that the three parts, ilium, ischium, and pubis. And first what we are going to study? We are going to study about the ilium. So it is a fan-shaped bone or the fan-shaped structure, right? So the ilium has an upper border, or not the upper border, an upper end and lower end. So the upper end is forming what? Is forming the iliac crest. Is forming the iliac crest. So we will discuss about the iliac crest later. So the upper end is forming what? The upper end is forming the iliac crest, and the lower end forms the acetabulum. The lower end forms the acetabulum. So the ilium has an upper end and lower end. The upper end forms the iliac crest, and the lower end forms the acetabulum. And it has an anterior border and posterior border. Anterior border and posterior border. So this one is the anterior border, which I am showing you with the arrow, and this one is the posterior border. This is which I am showing you the arrow. And then you have a medial border. You can see this is what? This is the medial border. So the ilium has an upper end, lower end, anterior border, posterior border, and medial border. And what? Medial border. This is the medial border. So these are the three borders. So we will discuss about each border in detail. And it has three surfaces. What is this surface? This surface is the gluteal surface. What is this surface called as? Gluteal surface. And what is this surface called as? This surface is called as iliac fossa. What is this surface called as? Iliac fossa. And what is this called as? Sacropelvic surface. What is this called as? Sacropelvic surface. Are you understanding? Are you understanding? Please answer. Are you understanding? Please answer. Any one of you?
Yes, sir.
Yes, right. So what did I tell you? I am only discussing about the part of the hip bone, that is the ilium. It has an upper end which is forming the iliac crest. The lower end is forming the. So I am getting some disturbance.
ట్యాప్ చేస్తే ఒక 4-line border వస్తుంది. 4-line border లా వస్తుంది. అక్కడ ట్యాప్ చేస్తే సరిపోతుంది.
Lakshmi Malayaja, I am getting some disturbance. Right, and the lower end is forming the acetabulum, and it has three borders: an anterior border, a posterior border, and what is this one? What is this border? This is the medial border. This is the medial border, and it has three surfaces: an iliac surface. This is the iliac surface, and this is the, what is this surface? The gluteal surface. The gluteal surface. And what else? The sacropelvic surface. So now I will discuss about only the upper end, and which is forming the iliac crest. So if you see here, the iliac crest extends from anterior superior iliac spine. You can see this part here. Anterior superior iliac spine to the posterior superior iliac spine. Please listen carefully, because teaching you on a two-dimensional view, this bone is bit difficult for us. But I'll try to make you understand if you listen carefully, right? So you can see what is this one. This is the iliac crest. This iliac crest has what? Anterior. It is extending from where? Anterior superior iliac spine. Anterior superior iliac spine. And what is this one? This is the posterior superior iliac spine. Posterior superior iliac spine. Then you can see this is somewhat in a S-shaped manner, right? Convex outwards. This is again, this iliac crest is divided into ventral 2/3 and dorsal 1/3. Is divided into ventral 2/3 and dorsal 1/3. Dorsal means behind. Dorsal 1/3. Right. And 5 centimeters the 5 centimeters from the anterior superior iliac spine, there is a tubercle. There is a tubercle. And what is that called as? Iliac tubercle. What is that called as? See this point, iliac tubercle. What is this called as? Iliac tubercle. Right. So this is the, and it has an outer lip, intermediate area and inner lip. So I am discussing about the iliac crest. It is extending from anterior superior iliac spine to the posterior superior iliac spine. Posterior superior iliac spine. And now what is happening? So this this iliac crest has an outer lip, an intermediate area, and the inner lip. And 5 centimeters from the anterior superior iliac spine, you have a tubercle. What is that tubercle called as? Iliac tubercle. Iliac tubercle. And this iliac crest is divided into ventral 2/3 and dorsal 1/3. Ventral 2/3 and dorsal 1/3. Got my points, please? Have you understood this point? Have you understood the points about the iliac crest? Have you understood the, yes. I'll be going slowly because I'll be teaching you this bone for 2 days. So slowly, if you don't understand, you can interrupt me anywhere and I'll try to explain you once again. Right? So please don't feel hesitated. Don't get hesitated. Or if you don't understand, you please ask me once again. I'll try to discuss once again. Right? Because it would be a bit difficult. If I had a bone with my in a dissection, it would have been easy about it. But anyway, don't worry. Right. So these are the, now if you see the iliac crest, now you see here, this is the iliac crest. So only this I have drawn. What I have drawn? Only this part, only the upper end of the iliac fossa I have drawn. So if you see here, this is the iliac crest. This is the iliac crest. So now you see here, the anterior superior, so it is extending, the iliac crest is extending from the anterior superior iliac spine to the posterior superior iliac spine, and it is divided into ventral 2/3 and dorsal 1/3. Ventral 2/3 and dorsal 1/3. Now you see here, it is again divided into what? An outer lip and inner lip. Outer lip, inner lip, and intermediate zone. In the outer lip, it is giving attachment to a tensor fascia lata. It is giving attachment to tensor fascia lata. Where is this tensor fascia lata? I'll show you if I can get it. And also, this outer lip gives attachment to what is this tract called as iliotibial tract. So you can see this one, the green one, iliotibial tract, which is extending from the outer lip and inserting where into this tibia. So that is which is extending from the ilium to the tibia. So that is why it is called as iliotibial tract. So the outer lip gives extension, it gives attachment to tensor fascia lata muscle, and also it is giving attachment to the deep fascia, and also it is giving attachment to a tract which is called as iliotibial tract. Means it is extending from the ilium and inserting into the tibia. That is why it is called as what? Iliotibial tract. Then what else? You can see, and the outer lip gives attachment to a muscle of abdomen. What is this muscle of abdomen? This muscle of abdomen is the external oblique muscle. What is it called as? External oblique muscle. So where is this external oblique muscle? If you see here, the first muscle here, you can see this is the muscle of abdomen. So this is the iliac crest. So it is giving attachment to a muscle of abdomen, that is the anterior abdominal wall, that is the external oblique muscle. External oblique muscle. Akshay. Right. And also it is giving attachment to insertion origin to a muscle, one more muscle, which you have seen in the muscle of back during dissection. What is that muscle? That is a latissimus dorsi muscle. What is this muscle? Latissimus dorsi muscle. So, if you remember the upper lip, the latissimus dorsi muscle gets its origin also from the, what is this one? From the iliac crest, and it is in, and also from the lower, from the scapula, inferior angle of the scapula, and getting inserted to the humerus. So this latissimus dorsi muscle is the one which will help you for climbing. So the climbing muscle is what? The latissimus dorsi muscle, right? And the intermediate zone gives origin to a muscle. What is that muscle called as? Internal oblique muscle. What is that muscle called as? Internal oblique muscle. So the first one is the external oblique muscle. The intermediate zone gives attachment to what? Internal oblique muscle. Where is this internal oblique muscle? You can see this is a cut muscle. This is the external oblique muscle. Inside this external oblique muscle, you can see what is this muscle? The internal oblique muscle. Internal oblique muscle. So these two muscles are also the, what are these? The muscles of anterior abdominal wall. Anterior abdominal wall. Right. Then you see behind. You see what is this? Then in the inner lip gives attachment to a transverse abdominis muscle. Transverse abdominis muscle. So the transverse abdominis muscle, you can see this is a transverse abdominis muscle, which is giving, which is also a muscle of anterior abdominal wall. You can see the three muscles: the external oblique muscle, the internal oblique muscle, and the transverse abdominis muscle. All these three muscles are getting their attachment from where? They are getting the attachment from the iliac crest. They are getting the attachment of the iliac crest. So see, this blue structure is the insertion of external oblique muscle. This is the origin of the internal oblique muscle, and this is the origin of transverse abdominis. And one more muscle is there from the inner lip. That muscle is called as quadratus lumborum. Why is this quadratus lumborum? So if you see this muscle here, this is the posterior abdominal wall muscle. So this you can see from the here, from the iliac crest. What is this muscle? Quadratus lumborum. Why the name quadratus lumborum has come? Because it is in a quadrate shape. It is in a quadrate shape, and it is a muscle of posterior abdominal wall. That is why this muscle is called as what? Quadratus lumborum. Quadratus lumborum. So this is also getting its origin from the dorsal two-third. From the ventral two-third of the iliac crest. And now this is all the attachments. These are all the attachments from the ventral two-third of the iliac crest. From the dorsal one-third, the dorsal one-third gives attachment to a gluteus maximus muscle, which you will study later. Gluteus maximus muscle, and then erector spinae muscle. This erector spinae muscle is a muscle of back. If you see here, where is this erector spinae muscle? So here in this region, you can see this muscle here, which is this called as the erector spinae muscle. What is this muscle called as? Erector spinae muscle, which is getting its origin from the dorsal aspect of the iliac crest. Dorsal aspect of the iliac crest. So, and then coming to the anterior superior iliac spine. Where is this anterior superior iliac spine you have studied? So this is the anterior superior iliac spine. The anterior superior iliac spine gives its origin from where? Gives origin to which muscle? The sartorius muscle. What is that muscle called as? Sartorius. So where is this muscle? You see in the anterior abdominal wall. In the anterior abdominal wall, I'm very sorry. From the anterior compartment of the limb, you can see a muscle. What is this muscle called as? The sartorius muscle. This muscle is called as sartorius muscle, which is getting its origin from the anterior superior iliac spine. And also from the anterior superior iliac spine, you get one more ligament. What is that ligament called as? Inguinal ligament. What is this ligament called as? Inguinal ligament. Inguinal ligament And also, what is this muscle? This is a sartorius muscle. Sartorius muscle and inguinal ligament get their origin from the anterior superior iliac spine. Anterior superior iliac spine. So now still now what did you study? So iliac crust comes as a 5 marks question for you. Iliac crust comes as a 5 marks question for you. When it comes, you have to draw this diagram and you have to explain something. What I have taught you now. So now still now what did we study? We have only studied about the iliac crest and their attachments, and about the upper end and the lower end, which is forming the, what is this form? It is forming what? It is forming the acetabulum. How the upper 2/5 of the acetabulum is formed by the lower end of the ilium. Lower end of the ilium. Are you understanding the class? Are you understanding the class? Please answer.
Yes, sir.
Right. So now coming, so still now we have studied only these two things. Now we will study about the borders. Well, how many borders I told you? It has an anterior border, posterior border, and medial border. Anterior border, posterior border, and medial border. So if you see here, the anterior border extends from the anterior superior iliac spine to the anterior inferior iliac spine. Anterior inferior iliac spine and to until the acetabulum. So this is the anterior border, and you have already studied that the anterior superior iliac spine will give attachment to the sartorius muscle, and also it gives attachment to what? The inguinal ligament. Inguinal ligament. And then you have the anterior inferior iliac spine. The anterior inferior iliac spine gives attachment to the iliofemoral ligament, or also called as, you have to remember this ligament, iliofemoral ligament means it is extending from the anterior inferior iliac spine, ilium of anterior inferior iliac spine, to the femur. To which part of the femur? An intertrochanteric line of femur. And this ligament is the strongest ligament of the body. Is the strongest ligament of the body, and this ligament is also called as ligament of Bigelow. This ligament is also called as what? Ligament of Bigelow. So what did you study? The anterior border of the ilium extends from the anterior superior iliac spine, and there is a notch here, and to the anterior inferior iliac spine, and below with that of the acetabulum. The anterior inferior iliac spine gives attachment to a ligament, which is also called as the iliofemoral ligament or ligament of Bigelow, and it is the strongest ligament of the body. And also it gives attachment to the straight head of rectus femoris. What did I tell you? The straight head of rectus femoris. So where is this rectus femoris? So if you see here, where is this diagram? I'll tell you. 1 minute. Wait for a minute. Yes, see here, this muscle, this is what? This is the anterior compartment of thigh. In the anterior compartment of the thigh, you can see this muscle. What is this muscle? This muscle is called as sartorius. You already studied. It is getting its origin from the anterior superior iliac spine. And you can see below, you can see this muscle. What is this muscle called as? Rectus femoris. What is this muscle? Which is present in the anterior compartment of the thigh. That is the rectus femoris. So this rectus femoris has two heads. What are those two heads? That is the straight head and also the one more head is present. That is called as 1 minute. That head is called as reflected head. That head is called as what? Reflected head. So the straight head gets its origin from the anterior inferior iliac spine. And where is this rectus femoris? The rectus femoris is a muscle which is present in the anterior compartment or the extensor compartment of the thigh. Extensor compartment of the thigh. So you have discussed about two muscles in the anterior compartment of the thigh. One is the sartorius and the second one is what? The rectus femoris. The rectus femoris, which I am showing you with the arrow. Right. So these are the two muscles. Then what is this one? This is the anterior border. This is all about the anterior border. So anterior inferior iliac spine gives attachments to a strong ligament, that is the ligament of Bigelow or the iliofemoral ligament, and also this gives a muscle attachment to a muscle. What is that muscle called as? The muscle called as the straight head of rectus femoris. The straight head of rectus femoris. Then coming to the posterior border. The posterior border extends from the posterior superior iliac spine to the posterior inferior iliac spine, and it is continuing with a notch here. What is this notch called as? This notch is called as greater sciatic notch. What is this notch called as? Greater sciatic notch. Greater sciatic notch. And this posterior border is continuing with the posterior border of the ischium. This posterior border is continuing with what? With the posterior border of the ischium. Right? So we have studied about what? About the posterior border. Posterior border extends from the posterior superior iliac spine and continues with the posterior inferior iliac spine, and this posterior border continues with the greater sciatic notch. So if you see here, the upper part of the greater sciatic notch is formed by the ilium, and the lower part of the greater sciatic notch is formed by the ischium. And you can see the greater sciatic, the posterior border is continuing with what? With the posterior border of the ischium. With the posterior border of the ischium, right? So this is about the posterior border. And this posterior inferior iliac spine gives attachment to a ligament. What is that called as? Sacrotuberous ligament. What do you mean by sacrotuberous ligament? The ligament which is extending from the ischial tuberosity to the sacrum is called as what? Sacrotuberous ligament. What is that ligament called as? Sacrotuberous ligament. Right? So you have studied about the upper end or the iliac crest, the lower end which is forming the acetabulum, the anterior border which is extending from anterior superior iliac spine to the anterior inferior iliac spine, and the posterior border which is extending from the posterior superior iliac spine to the posterior inferior iliac spine, and it is continuing with the greater sciatic notch. Greater sciatic notch. Then coming to the medial border. Where is this medial border? This is the medial border which is extending from the what is this one? From the iliac crest at the junction between the ventral 2/3 and the dorsal 1/3 of the iliac crest, coming downwards until the eminence. What is this eminence called as? Iliopubic eminence. What is that eminence called as? Iliopubic eminence. So which is this border? This is the medial border. This is which border? The medial border. So we have studied about the three borders, that is the anterior border, posterior border, upper end, lower end, and the medial border. So this now coming to the
medial border repeat చేయండి.
Medial border is extending from where? From the iliac crest. ఇక్కడ చూడండి ఇది. This is the iliac crest which we have already discussed. So this medial border is extending from the iliac crest, coming downwards here until the iliopubic eminence. Iliopubic eminence అంటే pubis కి ఇలియం కి మధ్యలో ఉన్న ఒక రఫ్ ఏరియా అని ఏమంటారు? Iliopubic eminence. What is it called as? Iliopubic eminence. So this border which I am showing with an arrow is what? Is the iliopubic border. No, sorry. So which is this border? This is the medial border. Not the iliopubic border. It is the medial border. Right? Now coming to the surfaces. So what are the surfaces? So the surfaces are the first surface which is between the anterior border and the medial border is the iliac surface. What is the surface? Iliac surface. What is this? Where is it present? It's between the anterior border here and the medial border here is the iliac surface. Then from the between the medial border and the posterior border and the greater sciatic notch is the sacropelvic surface. What is the surface called as? Sacropelvic surface. So this is the sacropelvic surface of the ilium. And the last surface, what is the surface? This surface is the gluteal surface. What is the surface? The gluteal surface. So ilium has three surfaces. What are those surfaces? One is the iliac surface, or also called as what? Iliac fossa. Iliac fossa. And the second one is the sacropelvic surface, which is present between the posterior border and the greater sciatic notch and the medial border. This surface is called as the sacropelvic surface. Sacropelvic surface. And the last one is what? The gluteal surface. What is the surface? The gluteal surface. Still now have you understood? So we have discussed about the upper end, lower end, anterior border, posterior border, medial border. And then we have studied about what? About the surfaces. Iliac surface, the sacropelvic surface, and the gluteal surface. Still now have you understood? Still now have you understood this point? Right. Now coming to the muscle attachments of the surfaces. If you see here, what are those muscle attachments? If you see this diagram, so this is what? This is the gluteal surface. What is the surface? The iliac surface. What is the surface? The iliac surface. So this iliac surface gives attachment to, what is this muscle here? This muscle is iliacus. What is this muscle? Iliacus. So where do you find this iliacus? We will see here. You can see this muscle here. Can you see this green one? What is this one? This is the iliacus muscle. So this iliacus muscle is getting its origin from the iliac fossa. Is getting its origin from where? Iliac fossa. So the iliacus along with the psoas major muscle is called as iliopsoas. What is this called as? Iliopsoas. So where is this iliac muscle? The iliacus muscle is getting its origin from the iliac fossa, and along with the psoas major muscle, it is called as iliopsoas muscle. Iliopsoas muscle. Right? So this is about the muscle which is getting its origin from the iliac fossa. Then the muscles which are getting its origin from the gluteal surface. Where is this gluteal surface? So this is the gluteal surface, right? So you can see this is the gluteal surface, right? This gluteal surface is continuing with the posterior surface of the ischium. The gluteal surface is continuing with what? With the posterior surface of the ischium. Right. So this gluteal surface is again divided. I'm not going to discuss again how from where to where. Is again divided by 3 lines into 4 areas. So what are those 3 lines? Those 3 lines are the posterior gluteal line, the anterior gluteal line, and the inferior gluteal line. So what did I tell you? I will repeat it once again. The gluteal surface is again divided into 4 areas by 3 lines. What are those 3 imaginary lines? That is the posterior gluteal line, which I am showing you with an arrow. That is the posterior gluteal line. Then you can see one more line here. You can see what is this line which I am showing you with an arrow. This is the anterior gluteal line and the inferior gluteal line. Right? So what are these? So this now coming to these are the four areas. The surface which is behind the posterior gluteal line, and the part of the gluteal surface which is present in between the posterior gluteal line and the anterior gluteal line, and the surface which is present between the anterior gluteal line and the inferior gluteal line, and the part which is present below the inferior gluteal line. So you see here now what are the muscles which are getting its origin from the gluteal surface. So you see here, what is this one? This is the gluteal surface of the hip bone. The gluteal surface of the ilium is, you can see, what is this muscle behind the posterior gluteal line. You can see a muscle which is getting its origin. That is the muscle. Which muscle is this one? The gluteus maximus. Gluteus maximus. And the line between the muscle which is getting its origin from the part which is present between the posterior gluteal line and the anterior gluteal line is what? The gluteus medius muscle. What is this muscle called as? Gluteus medius muscle. And between the anterior gluteal line and the inferior gluteal line, this muscle is called as gluteus minimus muscle. What is this muscle? Gluteus minimus muscle. And below the gluteal line is the reflected head of rectus femoris. So you have already studied this reflected head of rectus femoris muscle. You can see here, I'll show you all these four muscles once again. So if you see, you can see this muscle here. What is this muscle in the back? And what is this muscle? This is the gluteus maximus muscle. What is this muscle? Gluteus maximus muscle. And you can see here, what is this muscle here? This is the gluteus medius muscle. What is this muscle? Gluteus medius muscle. And in this posterior aspect, what is this muscle? The gluteus minimus muscle. What is this muscle? Gluteus minimus muscle. And where is this rectus femoris? It is in the anterior compartment or the extensor compartment. What is this muscle? This is the rectus femoris. Rectus femoris muscle. So what are those you have studied till now? You have studied about the muscles. What are those muscles? What are those muscles? You see here, the gluteus maximus, the gluteus, this is the gluteus maximus behind the posterior gluteal line. Between the posterior gluteal line and the anterior gluteal line is the gluteus medius muscle. Between the anterior gluteal line and the inferior gluteal line is the gluteus minimus muscle. And what is this muscle here? This is the rectus, the reflected head of rectus femoris. Right? So all these muscles. So you can see these muscles in the diagram. The gluteus maximus muscle, the gluteus medius muscle. If you cut these two muscles, then you get the gluteus minimus muscle. And in the anterior compartment region, you find the what is this one? The rectus femoris muscle. Rectus femoris muscle. Right? So this is all about the muscles which are getting its origin from the gluteal region of the ilium, gluteal region of ilium. Then coming to the sacropelvic surface. Where is the sacropelvic surface? So this is the sacropelvic surface. This part is the sacropelvic surface. And what is this one? This is an auricular area. What is this one called as? It is looking like an auricle or inverted L shape. So this auricular surface what does it do? It will articulate with what? It will articulate with the sacrum to form the sacroiliac joint. And what type of joint is the sacroiliac joint? This is a plain synovial joint. So which surface? The auricular surface which is present of the sacropelvic part is articulating with what? With the sacrum to form the sacroiliac joint. And what type of joint it is? It is a plain synovial joint. And you can see in the sacropelvic surface, this is the iliac tuberosity. So this iliac tuberosity gives attachment to the ligaments. The dorsal sacral ligament, the iliolumbar ligament, the interosseous iliac ligaments. All these ligaments are getting its origin from the sacral surface. And from which part of the sacral surface? The iliac tuberosity. So this is for the attachment of the iliac for the ligaments. What are those ones? The dorsal sacral, the iliolumbar and interosseous ligaments. Right. And then the pelvic surface. So this part you can see here, in front of the auricle, there is what? This is the preauricular surface. The preauricular surface. The preauricular surface gives attachment to ventral sacroiliac ligaments. Ventral sacroiliac ligament. And it is also, you can see the notch will be greater, will be more in which part? In the multiparous woman, because during pregnancy, there will be stretching of these ventral sacroiliac ligaments. Ventral sacroiliac ligaments, right? So this is what this preauricular notch is. So when you study the differences between a male pelvis and female pelvis, then you come across, what is this one? The notch, the preauricular notch is more in females when compared to the males because of this ventral sacroiliac ligament, stretching of the ventral sacroiliac ligaments in multiparous. Have you got this point? Are you understanding? Please answer. Are you understanding? Right. So this is about the ventral sacroiliac ligaments, which is attached to the preauricular notch. Preauricular notch. And this is what? This is the pelvic part, sacropelvic part. I told you. This pelvic part. This is what? Yes. Tell me, Lahari. What's your doubt? Any doubt? Right. And you can see here, this is what? This is the greater sciatic notch. So the upper aspect of the greater sciatic notch gives attachment to a muscle which is called as piriformis. What is that muscle called as? Piriformis. So where is this piriformis? I'll show you in this diagram. So I already told you in this gluteal region, this is the gluteus maximus. This is the gluteus medius. And this is the gluteus minimus, and this muscle, which is getting its origin from the sacrum and also the upper margin of the greater sciatic notch, is what? This is the piriformis muscle. And this piriformis muscle is a key muscle in the gluteal region. Which is the key muscle in the gluteal region? The piriformis muscle is the key muscle in the gluteal region. So if you see here, so what is this one? This is sacropelvic surface and the greater sciatic notch. And also the which ligament I told you? Ventral sacroiliac ligament. And this preauricular notch is more in multiparous woman because of the stretching of the ventral sacroiliac ligament. Ventral sacroiliac ligament. So this is all about the which one? The ilium of the hip bone. Have you understood the ilium? Have you understood the ilium? Please answer. So I told you the upper end, lower end, anterior border, posterior border, the iliac surface, the sacropelvic surface, and also the gluteal surface. And also I have told you about the muscles which are getting their origin. How many of you have understood? Please answer.
Yes, sir.
Yes, sir.
Yes, sir.
Now coming to the another part of ischium, that is what is this one? First we have discussed only about this part, what is the ilium, and now we are going to discuss about the ischium. So this ischium also has an upper end and lower end. Upper end and lower end, and it has a body and ramus. Body and ramus. So this ramus of the ischium will join with the ramus of the pubis to form the conjoined, means it is joining here, conjoined ischio-pubic ramus. What do you call it as? Conjoined ischio-pubic ramus. Conjoined ischio-pubic ramus. Right? So if you see here, this is the ischium. The ischium has a body and ramus, and the ramus will join with the pubis to form the conjoined ischio-pubic ramus. So like ilium, it also has an upper end and lower end. The upper end is forming the acetabulum. The posterior inferior aspect of the acetabulum is contributed. How much it is contributed? What is the ratio? The 2/5 of the posterior inferior aspect of the acetabulum is contributed by the upper end of the ischium. Is contributed by the upper end of the ischium. And the lower end, which is again a 5 marks question for you, will form the ischial tuberosity. The lower end will form the ischial tuberosity. So now in this class, we will only discuss about what is this one? The ischial tuberosity. See here, this is what the lower end of the ischium, which is forming a comma shape, roughly a comma shape ischial tuberosity. So this is the ischial tuberosity. Later we will discuss about the ischium and pubis tomorrow, but only about the ischial tuberosity we will discuss. You can see again, this is the ischial tuberosity, which is formed by the lower end of the ischium. Which is formed by the lower end of the ischium. So where is this ischial tuberosity and the attachment of the ischial tuberosity? So when you study about the attachment of the ischial tuberosity, when you study about the attachments of the ischial tuberosity, you see here. So this is the lower end of the ischial tuberosity. You have to draw the diagram in examination. So this lower end of this ischial tuberosity is again divided into upper part and lower part. Upper part and lower part. By a line, what is this line? The horizontal line. By what line? By the horizontal line. So this again, the upper part is divided by a oblique line into supralateral and supromedial. Supralateral and supromedial quadrants. I am again discussing the ischial tuberosity is divided by a horizontal line into upper quadrilateral part and lower triangular part. The upper quadrilateral part is again divided by an oblique line into supralateral area and also infromedial area. The supralateral area gives origin to what is this muscle called as the hamstring muscle, that is the semimembranosus. Gives origin to which muscle? The semimembranosus. The infromedial area gives origin to which is this muscle called as the biceps femoris and semitendinosus. Biceps femoris and semitendinosus. Are you understanding? The semimembranosus in the upper lateral area and semitendinosus and the biceps femoris in the lower medial area. And now the lower aspect is divided by a vertical line into outer aspect and inner aspect. So the outer aspect gives attachment to muscle called as the ischial part of adductor magnus, and the inner aspect connects it is the one which is connecting the pelvis with the sacrotuberous ligament, and also it is covered by a fibrofatty tissue. It is covered by the fibrofatty tissue. So now we will study some. If you see here, again the same thing. Again the same thing here. What is this one? This is the ischial tuberosity. The ischial tuberosity, this one, this side. Right. So this is the ischial tuberosity, or else I'll show you in this page. Right. So this is the ischial tuberosity. So this ischial tuberosity is the lower end of the ischium, and it is divided by what is this line? By the horizontal line into upper aspect and lower aspect. The upper aspect is again divided by a quadrilateral area, by an oblique line into supralateral and inframedial. The supralateral area gives attachment to semi-membranosus, and the inframedial area gives attachment to semi-tendinosus and biceps femoris. And the inferior aspect is again divided into by a vertical line into an outer aspect and inner aspect. The outer aspect gives attachment to a muscle. What is this one? The ischial part of the adductor magnus muscle. Ischial part of the adductor magnus muscle, and the inner aspect is covered by what? Covered by the what is that one? The fibrofatty tissue. So if you see here, these muscles you will understand better. So these are the hamstring muscles. These are the hamstring muscles which are present on the flexor compartment of the thigh region. Flexor compartment of the thigh region. You can see this muscle. This all are getting the Saumika. What's your doubt? What's your doubt, Saumika? So the ischial tuberosity is giving its origin from what is this muscle? You can see the biceps femoris muscle. Biceps femoris, you can see. And also what is these two muscles are the hamstring muscles, which you see in the posterior compartment of the thigh, the semi-tendinosus muscle and semi-membranosus muscle. Semi-tendinosus and semi-membranosus muscle. And where is this adductor magnus muscle? You can see where is this one? This region, this muscle, this muscle is a part of hamstring, and also this muscle is also a part of the medial compartment. What is this muscle? The adductor magnus muscle. So those muscles, all these muscles, the semi-membranosus muscle, the semi-tendinosus muscle, the biceps femoris muscle, and the adductor part of the adductor magnus muscle, all these are getting their origin from the ischial tuberosity. Right? So for today, I'll leave you, and tomorrow we will discuss about the ischium, and also we will discuss about the pubis. So tomorrow will be the part of the end of the bone. What is this bone? Ilium. Right? Are you understanding the class? How many of you are understanding?
Yes, sir.
Yes. Okay. Thank you for today.